Welcome everyone. We are here at ACC 22 in Washington, D.C. My name is Vikram Sharma. I'm a fellow in training at the University of Iowa Hospitals and Clinics. It's my absolute pleasure to introduce Dr. Bhatt, who's here with us today. He's, of course, the Executive Director of the Interventional Cardiovascular Programs at Brigham and Women's Health, as well as a Professor of Medicine at the Harvard Medical School. He has a wide range of research interests, include acute coronary syndromes, preventative cardiology, and cardiovascular interventions. He has played a pivotal role in several groundbreaking trials as a primary investigator, a co-PI, chair, and co-chair. These trials include the Charisma trial, the Reduce-IT trial, Crescendo, Cogent, and Champion trials, just to name a few. Thank you so much for making time out of your busy schedule to talk to us today. And a lot of people see you, including myself, as a mentor. What advice would you give to fellows in training who are trying to set themselves up for an academic career? What are the things they should focus on, or maybe if there are any pitfalls they should avoid?
Well, thank you for those kind words, and thank you for asking that question. It's an important question. I realize there are a lot of, obviously, young fellows that listen to these programs. I guess in terms of advice, the first thing I'd say is, keep your spirit up. I mean, it's been tough. There's a pandemic that's just gone on for 2 years that we're hoping is ending, but, who knows what's going to happen exactly. And I think just having survived that, that's pretty good. It's not easy. I mean, that's the first goal of a pandemic, right? Survive the pandemic. Survive the zombie apocalypse, right? That's always the goal of survival. And that's not always easy to do, right? It's not easy to always survive physically. It can be particularly tough to survive mentally, right? So just being alive and in good spirits and good health, I think, is quite an accomplishment. And not just physicians or physicians in training. I mean, everyone that survived should be thankful and happy and grateful about that. But, it has been a tough time, and I think it's important to at least step back and acknowledge that fact. And, I think for people in training, it's been tough in a number of ways, right? I mean, for some people, it's disrupted their training. They haven't, especially during the surges, it might have cut back on their ability to do procedures or different imaging tests as the hospital might have scaled back. So, real implications there. It's made searching for jobs more challenging, interviewing more challenging. A lot of places are nervous about hiring because there's a pandemic and, they've got other sorts of priorities like taking care of sick patients that are coming in. So now that things are winding down, I'd say, hopefully life will go back to more normal. And, important to reemerge from hibernation and as we're kind of doing here live and, re-engage with the world and realize there's a lot of good stuff happening out there. In terms of answering your question more specifically, I think, core skills for academicians, but not just academicians. I'd say it's really important to learn how to analyze data well. Even if you're going to go into private practice and never, or at least you think you'll never do research again, that's a useful skill. Otherwise, people like me will be telling you how great their trial is, and you're not really able to critically evaluate, is that something that actually is useful for my patient or not? So the ability to analyze data is important, even if you plan to never, ever do research again after training is done. And other essential skills other than just the ability to synthesize and analyze data that you're reading in journals, for example, or listening to from presentations, I think a useful skill is being able to write. And again, if you're going into academia, if you can't write, your career is over before it started. You have to be able to write, you have to be able to write to publish, you have to be able to write grants. And if you can't do all those things, you're just not going to thrive in academia. So the ability to write well is very, very, very important. And let's say you're never going to publish again, you think, because you're going to go into private practice somewhere. Well, the ability to write there actually has value as well in your community newspaper. If you can write about heart attacks, well, that's going to drive business to your practice instead of the practice down the street. So again, that ability to write and synthesize data in a way that could be understood by your colleagues and or by lay people is a very valuable skill. It's worth mastering. The other one is the ability to present well. Because, again, if you want to succeed in academia, you have to present your data. Whether it's virtual, whether it's live, who knows what the future holds. I think virtual is going to be pretty big in the future. But still, it involves standing or sitting in front of a camera and presenting your thoughts in a coherent way, hopefully in a succinct way. hopefully not rambling on like I am, but just getting a message across. That's what presenting is about, and that's really an important skill. And you just can't thrive in academia if you don't have that skill. And like every skill, writing and presenting are learned skills. No one's born with those skills. Practice, makes perfect. Some people have more of a natural affinity, others don't. But it's like procedural or imaging skills in cardiology, with practice and the right training and mentorship, anybody that is intelligent can master those skills. And obviously, if you're in a cardiology fellowship, you're intelligent. Even if you're going into private practice, the ability to present really, really important because, again, you might be presenting to a crowd of lay people, but those are your future patients potentially, or their family members are your future patients. Or it might be to your local news channel that you're talking about, a celebrity who just had a heart attack or something. Again, that is useful in terms of providing the community knowledge and a service, but it's also useful to your practice because it'll drive patients to your practice. So I think these skills I mentioned are useful for academicians. That was your specific question, but even for those folks that aren't going into academia, it'll be useful. Anyway, for the people that are listening, for your generation, that distinction between academia and private practice is going to continue to blur. In academia, there's a lot of pressure to produce RVUs and see more patients and do more of whatever it is you do, imaging or procedures. And in private practice, well, the solo practice is kind of dying. Many people are in group practices, and many of those group practices are getting gobbled up by large healthcare systems. Some are not-for-profit, some are for-profit, some consider themselves academic, but there's a lot of blurring of lines. So the bottom line is, as you build your own personal brand, which you take with you wherever you go, these skills that I mentioned would be really useful to develop.
Great. Those are awesome learning points for all fellows in training, not only people who are striving for an academic career, but in general, that's going to be useful for everybody. So once again, thank you for taking time out to come and talk with us about your trial, and we look forward to the results of the Reverse It trial that hopefully we'll present in ACC 23. So thank you once again.